If these are African problems, as His Excellency Paul Kagame said, Africa needs to write its own history. Africa needs to own its own problems. This is step number one towards that.
Providing surgical services can ensure that people are healthy and can fend for themselves. Africans don't like to be dependent on anyone. They like to fend for themselves. We must empower them with that. All the resources, the human resource, the mental resources, and everything else that we have to solve our own problems. So let's stop labeling ourselves as poor, because we are not.
To come together with a consensus on how we can position surgical care in a manner that it's safe, is accessible, is affordable, and that every person, even irrespective of their location within the continent, is able to have good quality surgical intervention when the need arises. Most importantly, we just want to ensure that every patient that requires a surgical intervention in Africa is given that opportunity to access safe, high-quality intervention at their own location or their own local communities.
We need to come up with different campaign systems within the internal so that the tertiary level do campaign at the primary and the general level. And even we need to communicate with different partners and the stakeholders so that they will come from different countries to our country to do campaign so they can decrease significantly, especially the surgical backlog that we need to refer abroad for better treatment. And the other one is to encourage daycare surgery.
Each country, its own story, having to work in its own context. Some were redirecting how their finances worked, and finding creative solutions, including changing the way taxes happen and redirecting some of those governmental funds to strengthen health systems throughout the country. Others were committing to ensuring that every province had a tertiary referral hospital that was fully equipped. Others saying professional migration, aka brain drain, is a real problem for us, and so we need to tackle that. We're going to tackle that by changing salaries for our doctors and thinking about schooling for the children and the sorts of resources that are needed to not only recruit but retain healthcare professionals.
40 African countries just signed up, as you have seen them earlier, to have a united voice towards access to surgical and anesthesia care. So we hope this is step one towards the right direction.
I want to thank you for joining this initiative, but also to challenge you that we need to be clear on what we want to achieve so that we can make a difference in this field that has suffered the most. If you compare it to other fields of public health, surgery is one of the few lagging behind because of lack of advocacy, which you are doing, but also because of lack of concrete actions to change and lack of bringing people together to make this change we want to see.